Terrific to have everyone here today. Thank you for joining us for this webcast. We're excited to discuss with you opportunities in nursing education and the chance to really scalably get after the nursing shortage in the United States. I'm Kirstin Hill, President and COO of Social Finance. We're a national nonprofit and a registered investment advisor. At Social Finance, we identify opportunities to adapt market mechanisms and financial tools to really try to scalably address some of our country's most enduring problems. We always do that in partnership with others and with experts in the field, and I'm joined by two of them today. Let me introduce Anmy Mayfield, who is the Vice President and Dean for the College of Nursing in the Michael O. Leavitt School of Health at Western Governors University. Anmy has been a nurse practitioner for over a decade and a nurse for nearly 2 decades. She has a wide variety of experiences, including intensive primary care for uninsured and low-income patients, family practice, urgent care, nephrology, organ transplant, and more. So a real expert here in Anmy. I'm also joined by a dear friend and partner, Jeannie Virden, who is the Chief People Officer for Central Health. As many on this call know, Central Health is located in Austin, Texas, and is Travis County's taxpayer-funded hospital district. The Central Health system is dedicated to improving health outcomes for everyone in the Austin area, in particular those who need it most. And in 2024, just to give you a sense of the scale of the work that Jeannie and their team do, the system served more than 170,000 people, so 1 in 9 Travis County residents. So we have a short time together today. I'm going to provide a brief overview of the work we're doing together, followed by a moderated Q&A. But as you have questions, whether now or as we go along, please put them in the chat and we'll try to get to them at the end. So why are we doing this work and what are we doing? There's a nursing crisis in the United States. We have an enduring need for more nurses and insufficient supply of new nurses. And that's despite the fact that, as Anmy can attest, nursing is a hard job, but a good job. It offers good starting salaries and the opportunity for meaningful wage growth over a nursing career. So why is this happening? There are a lot of reasons, but 2 key ones. One, the traditional nursing educational system is constrained in its ability to expand by physical space, by teaching capacity, by clinical placements. And 2, it's expensive to become a nurse. It takes a long time, school costs a lot, and it's hard to go to work while going to traditional nursing school. And so the work the 3 of us are doing together and our organizations are doing together with ReNEW really seeks to address both of these foundational issues. First, through WGU's innovative educational approach, combining online competency-based models that allow us to reach non-traditional nursing students where they are, with hub-based in-person learning in locations across the country, and a clinical placements system that flexes to the needs of both learners and employers, combined with a fair, scalable financing approach through social finance that really breaks the binary of either often expensive and burdensome loans or excellent but not scalable scholarship models. In short, we provide principal-only loans, so 0 interest, to Pell-eligible students that are repayable if and only if they succeed, so only when they get a job paying above a minimum amount. And as Jeannie will tell us today, if graduating students choose to work at participating employers, those employers will repay those loans on their behalf, giving people a debt-free path to becoming a nurse. So together, this combination of educational and financing innovation provides really a scalable approach that can make a real dent in the nation's nursing shortage and the labor market needs of employers. It can support the creation of a nursing population that represents the communities that they serve. And it creates the opportunity for meaningful economic mobility for a new generation of nurses. So as you can tell, we're pretty excited about this, but let me turn it to the experts to talk about it. So Anmy, can I start with you? I'd love you to tell me about what's unique about WGU's model for bachelor's in nursing and how it really does allow you to meet people where they are and really create a different character, a different nature of student body at WGU.
Thanks, Kirstin. So at WGU, we're very proud to offer competency-based education, primarily delivered online, so that we can meet students where they're at. With our competency-based education model, we're a nonprofit online university where primarily our programs within the Leavitt School of Health are offered online. And then for programs like nursing, we have a hybrid model where we bring our students into those simulation centers that are located regionally across the nation. And then also connecting them with health systems so that they can find those clinical placements and be able to get that clinical competency training while they're in their communities. One thing that we're very proud of is training in place. A lot of folks don't have access to nursing programs that are close to them, but they'd like to stay within their communities that they're already dedicated to. And so we're proud to be able to offer our nursing programs across the nation to these individuals. They can seek their coursework online, but then they're able to get their clinical training in these regional labs, but then also do the clinical placements within their communities.
Maybe I can just quickly ask a follow-up there in terms of some of the characteristics of your student body, because that really is such a unique model, and it does then allow you to reach a different student at times for whom traditional nursing education might feel not possible.
Yes, primarily our students are older, and then they are also in that what we call sandwich generation. They're taking care of young kiddos at home, and then they also might have aging parents that they're taking care of. And for our model, we're able to offer school, classwork, et cetera, at their time, like what's convenient for them. And we're not based on like a midterm and final schedule. They're able to schedule their exams when it's convenient for them, whether that be in the middle of the night, we're the night owls at WGU, or sometime in between work shifts. We're here for them when we can provide the educational support and need for the students. Not only that, we offer faculty members called program mentors who follow our students throughout their journey. So someone that is their cheerleader, that is their accountability partner, et cetera, to be able to help them be able to proceed and progress and succeed through the program. At the end of the day, once you're a WGU student, we're wanting to see you succeed in our programs and get to graduation.
I love that. Jeannie, of course, it makes me think about you and Central Health and the importance of community to what you do. Could you tell us about that and how you thought about this program connecting to that fundamental tenet of Central Health?
Absolutely. So our mission is to provide healthcare to the uninsured and underserved residents of Travis County. So really, we are focusing on these underserved populations, and WGU's student population is very representative of the patients that we have. So it just marries up so well with what we're looking for in prospective candidates and employees.
I love that. And so then tell us a little more about what brought you to ReNEW, Jeannie, kind of what you saw, kind of what some of those conversations were like as you thought about it and discussed it with your team.
Yeah, absolutely. I looked at it as a unique opportunity to have a very different way to support community members, people who are in school, and be able to move them into an employed position so that they actually start their career not in debt by traditional financing models like you just talked about, right? So it was just such a way for me, when I learned about it, it was unlike any other opportunity we had ever seen. We invest up front to these students, right? So we want to make sure that they're successful. And then as the employer, then they come here and then we help support and basically repay on their behalf as long as they're working with us. And so there's no commitment to us. There's no commitment, on their part. But as long as we do that, and we're investing them as soon as they walk in that door and ensuring that they have a sustainable career, and they're able to invest in their future and their families.
Oh, I love that. So maybe, Anmy, then I can ask you to jump in. WGU as an organization, as a university, is enormous. How did you think about the role of ReNEW in your bachelor's in nursing program? Why did this model stand out to you?
I think one of the things that WGU has always focused on is meeting workforce needs. It was founded by 19 U.S. state governors back in 1997. And for their focus, it was to think about what the community's workforce needs and how can higher education meet those needs. Fast forward to 2025, and we're at that spot where we're taking a look at the workforce shortages that continue to persist in nursing and how can we meet these needs. We're really proud that in our pre-licensure nursing program, we've had about 2,300 graduates. But the workforce shortages continue to persist across our communities. And for us, we currently have about 3,500 students in our programs. And part of that is making sure that they can persist and be supported throughout their program. What was drawing to us about the ReNEW Fund is making sure that in those final 2 years of nursing programs, they have significant increases in commitments to clinical hours, to joining the simulation centers for their trainings. And then in the midst of that, they are balancing family, work, etc. And so how can we make sure that these students are supported financially so that they can succeed and persist through their programs? And so with the ReNEW Fund, with great partnerships with philanthropy and then also our employer partners, understanding that it's a kind of convening of all the different organizations and individuals in our communities to be able to come together to support that nursing student. Making sure that they understand that not only can they get a high quality education, but they are able to get high quality placements and simulation training, and then partnerships with employers who will support them as they are starting their years as a nurse. I think as a nursing student back in the day, this type of financial support, I think, is very important as you take a look at the demographics of our students and how they're supporting their families, and just understanding what are some of the barriers that keep them from being able to persist and complete higher education. I think the ReNEW Fund hits this directly and makes sure that they have the support and not only a community support, but financial support that they need.
Yes. I mean, Jeannie, maybe you can chime in there because, of course, you see your nurses at Central Health every day. You experience this question of the need for nurses in a community. Can you talk to the experience of a hospital, but also the experience of your nurses and how you think this ReNEW Fund, as Anmy said, starts to think about the real lived experience of folks as they seek to become and live as nurses?
Well, exactly. So, I mean, again, that's part of the attraction of it is that there's so much experience in these communities, just from being in those lived experiences, that they don't always translate over if they don't have access to the education. So, that's first and foremost. They're working in the communities that they serve. Two, we are utilizing them for the patient care and the development. So we're investing in our teams. And I think the nurses are so usually overworked and understaffed because of the shortages. So really developing a healthy, sustainable pipeline of nurses to come in and to work within the organization to support the nurses that are there and to continue their growth and development. So
I love that. I mean, I think it's really this full life cycle, as you described it, which is helping people in the community see that something might be possible that they had never previously imagined might be available to them, whether it's practically the barriers of education or financially the expense, and then understanding what it means to be supported both through that educational experience and through that working experience. I'm going to remind everyone who's with us today, just if you have any questions, to pop them in the chat, and so we can get to them. But one I see that has come in that I love, which is to talk about what does it mean to have community representation in care, and why is that important? How do we think about engaging with the community and health outcomes, and how this talk to us about in real life what that means and why that matters.
So one of the research that we've seen in higher education and the nursing workforce is oftentimes patient outcomes are better when your healthcare providers, including your nurses, reflect what your communities look like. It's the concept of having that shared lived experience and understanding where your patients are coming from. I think oftentimes when folks are seeking healthcare, it's a vulnerable place to be, and to have someone who understands what your lived experience is, whether that be culturally or just geographically, understanding where that means and what it would mean to manage any chronic conditions or any kind of acute medical conditions. I think is really important to have healthcare professionals who have that empathy and who are able to understand, okay, this is how you would navigate this because I live in the same community you do. These are the grocery stores I shop at. These are the pharmacies I go to, et cetera. And so being able to train the next generation of healthcare professionals, including nurses, to be able to reflect what our communities look like is very important. Not only with that engagement and patient interaction, but then also understanding that diverse workforce population can help our communities continue to grow and thrive.
And I'll just jump in from an employer perspective, having a diverse workforce means that we hear all of the voices, yes, not just one or two. And so it really helps define, decision making. Obviously we see patient, interactions and customer service, get better. And so I think having a diverse workforce is important for all employers.
That's terrific. So one of the things that I think is so special about the ReNEW Fund is that it has this structural scalability to it. Maybe can each of you speak to what you see as kind of the opportunity for scale in this model that we've pulled together? Anmy, maybe I can start with you.
Thanks. So in terms of scalability, we love the renewing and kind of that pay it forward model in this space, because I think while scholarships, kind of traditional scholarships are very valuable, understanding that the pay it forward model will just exponentially affect and impact additional students was very appealing to us. And then for us to be able to find a fund that could help match the scale that we operate at WGU. We are currently in about 24 states for the pre-licensure nursing program and continue to expand. And for us being able to replicate this across the different communities across the nation was important. And
Anmy, can I just interrupt you quickly? As you talk about, can you give us a little sense of the scale of WGU as a whole? Because this is something I've just learned about over the past few years.
Yes. Yeah. So since starting in 1997, and then in the Leavitt School of Health, we started in about 2009 for the nursing programs. We've been able to continue to grow and scale into 24 states in pre-licensure nursing. But we have 20 other programs and 110,000 graduates within the Leavitt School of Health. At WGU itself has about 400,000 graduates across our different school disciplines. And so this is in the School of Business, the School of Technology, School of Education, and the School of Health. And so for us to be able to meet where those deserts are for higher education, we're providing an educational model where we're able to meet the student where traditional, perhaps brick and mortar higher ed institution doesn't meet their time schedules and family needs. And so for us to be able to continue to grow and scale and then be able to tackle these real workforce shortages is something that we're continually striving for at WGU.
And for us as an employer, it was, first and foremost, it's mission aligned, right? It solves a problem for us. And then when we look at the risk and the reward, yes, there is no risk. It's all reward. It's all upside. These students have gone through a verified program. They come out, they're skilled, they're licensed, they are ready to start working from day one. All we have to do is pay back their tuition the loan at no interest. but we're also paying it back into the fund. We're not paying back the loan funder. We're not paying interest on this. And then that is reinvested into more students. So it's a sustainable cycle for us. And again, the only risk is that they don't stay with us for their entire career, but that's okay. If we're the first, stepping stone in their future, in their career, that's absolutely fine with us. And we're able to support and really help the overall healthcare community from our perspective.
I love that. I think about a few things each of you has said, which is one of the things that's special about ReNEW is it brings together all the critical constituents that need to come together to get after this enduring challenge we have around our nursing workforce in the United States. But it does so in a way that fundamentally rebalances risk and reward for everybody involved, right? We break out of this binary from a potential nurse's perspective of, I need to take out expensive, maybe unsustainable loans to go through this program, or I'm lucky enough to get a scholarship, which of course would be terrific, but there's not enough to go around. And then from an employer's perspective, Jeannie, I love what you're saying, which is it enables you to support nurses, but in a way that is appropriate in time and in risk for an employer, which is as you hire them, as you retain people, to really support a nurse as they're employed with you at Central Health. And then as that happened, to create this virtual cycle of paying it forward so that repayments don't go to repay any investor. They go just to support that next nursing student and that next nursing student, creating that really positive flywheel. Okay, so taking a few questions that have come in. One of the things I think is special about ReNEW is the way it combines to sometimes things that don't always go naturally together, which is we have the scalability that we just described, but then you have the real human stories and experiences. Anmy, might you tell us about some of the student stories of people that have engaged with ReNEW? And Jeannie, I'm thinking about, I remember you told us about somebody who had worked for Central Health, and I'd love for you to tell her story again, if you might. So Anmy, start with you.
We've had a great number of student testimonials about the ReNEW Fund. And I think for us, it is what drives our work every day, to hear the impact, the tangible impact that the ReNEW Fund has had for them. I'm just sharing a couple of them. One is a student whose husband was in the military, but is now disabled. And so she's the sole provider for the family. And so they have 6 children from their blended families. And things were getting tight financially for them, but the ReNEW Fund was able to help kind of release some of that burden of the financial aspects of a nursing program. And for her, she shared that this was something that allowed her to then still find that balance between being a mother, a wife, and then also a student. And then just reassured her that nursing was the right path for her and that she could do this. And for her to be able to have something that can support her in her journey. Previously, she was an LPN and then a CNA instructor, a CPR instructor. And for her to be able to take this next step in her career path and become a nurse has just meant the world for her. And this extra money has just been able to help her then, I think, see her future of helping more people as a nurse. And then I'll just share another example. There was one who is now considered going to traditional school, but it didn't fit her lifestyle. She was a mom. She's a mom and a wife. And to understand kind of how can she be like working as an LPN, she's been doing that for the last 6 years. How can she continue doing so, being a primary breadwinner for her family, but then still being able to live her dream to become a neonatal ICU nurse. And for her, understanding that the ReNEW Fund was coming in when she had almost maxed out her financial aid, et cetera, and being able to have this additional monies to help support her through her program also meant that she could then continue to focus in her work as an LPN and then continue on in her journey.
I love that. It's reassuring people that it's okay to invest in yourself and knowing I can do so in an affordable way, and that the repayment will either come from terrific employers who participate in that program, or will happen if and only if I succeed and get that job paying above a certain minimum amount. But Jeannie.
Yeah, so we have another workforce development program that we offer. And as we were graduating our medical assistant group, one of the team members just talked about how impactful it was to have the support and the time and the dedication to be able to focus on the studies and complete the program. She thought that she would never be able to do this, to take the first step into her healthcare career, first of all. And so she was just so grateful, and she just talked about how life-changing it was for her. So then even better, as an employer, I'm also able to say, oh, by the way, when you're ready, here's a great program with a great university, and we can actually help support you through that. And kind of, the testimonials that you were just providing just talks about, getting a foot in the door and helping support them can lead to so much for so many people that may not have ever had the access.
Never have dreamed that this was even possible. I love it. Okay, so you knew our time together was short. One final call to action for the audience today. Jeannie, then Anmy.
So, employers, sign up. Be a featured employer. There is no risk. It is all reward. Just do it.
And then from us, the nursing workforce shortage is, I think, something that's in front of all of us. I love the opportunity to be able to partner with folks that have this shared vision and mission, partnering with higher education, philanthropists, and then also employers. I think come join the cause. I think being able to help support our future nursing generation not only supports the nursing workforce, but our communities at large. And just understanding how we can improve the health of our U.S. population.
Oh, thank you for that. Anmy and Jeannie, for a terrific discussion today. I feel you really demonstrated that when we come together, we can imagine different systems and a different future that can really serve the needs of our students, of our employees, and of our communities. So thank you to everyone who joined us today for this webinar. You're going to receive an email with a link to the recording. We would love to continue the conversation with you and get your feedback as you reflect on today's conversation. This is going to be the first of a few webinars on this topic, so please watch out for the next webinars, including highlighting the perspectives of ReNEW students, which I know we're all going to want to hear, as well as funders. So thank you again, Anmy and Jeannie. Thank you, everyone, for joining us.
Thank you.
Thank you, Kirstin.